Hello and welcome to the Hard Questions. It is part 2 of our extended interview with the UN AIDS Executive Director and the Undersecretary for the United Nations in charge of global health and pushing back against HIV. Winnie Banyima joins us once again on the Hard Questions show. This time, we are taking a deeper close at her work at the United Nations and at UNAIDS. All right, thank you again for accepting to be with us. I know that this is so deeply connected to you, and the fight for global health is at the center of your career. But let's start with the most important question. How do you navigate the politics at home and your work at UNAIDS and at the United Nations? It's quite a tricky balance, isn't it?
I juggle like every other woman. Every woman knows this thing, juggling. To mind your home, your children, and care and love your husband. To do a job out there in the public, and to be part of your community and to contribute in your community, whether it's a village or a country. So I juggle, and I don't juggle very well, I have to say. Sometimes things fall out of my hands, but I work with very, very kind people at my job. So when I don't keep timelines, when I fail to show up where I'm needed, they are forgiving, they feel it for me. The same at a family level. I have a wonderful, loving family who step in and do what I should do, and I don't feel pressure to be the one to deliver on many things. So that's how I manage.
Yeah, well, I mean, sometimes I think, okay, you know how international organizations have our policies, you cannot be doing this, you have to do this. I mean, by the fact that you can, still be part of the discourse and also meet your obligations at UNAIDS, it's really amazing. So let's talk about the global fight for...
No, let me address that.
Yeah.
The things I've been telling you here about my husband, the United Nations does not stop me from defending my husband. He's my husband. He's in jail and he's facing political persecution. I am not disallowed from defending him. I've spoken to you as a Ugandan. I've not spoken to you as a member of any party. I'm not in any way being partisan. I'm giving my general observations as a Ugandan about this country, because my husband's fate is tied with what's happening in the country. So those who would want to make it appear that I'm breaking UN rules, I want them to know that I'm a responsible leader and I'm doing what I'm doing, very much aware of the rules that govern me, and carrying on with my responsibilities in the best way that I can. They shouldn't waste their time trying to undermine me or to imply that I am trying to be a politician in Uganda. No, I'm just sharing with you my views about how I see this country going.
Yeah.
And I've told you that you asked me, do I want to run? I said, well, that may happen one day, but I'm keeping you
guessing.
Right now, I'm doing my job.
Correct.
I'm on contract. I've not picked up papers for nomination.
Interesting, ma'am. So let's talk about your job here.
Yeah.
The global fight against HIV sits at the very core of your JD and also passion, as a woman, as a person who has been leading this global fight. Your work was hit by the change in global funding. I mean, USAID closed, many international organizations, are struggling financially to keep their work going. My question to you is, how did the global shifts in funding affect your work?
Very seriously. very significantly, because this fight against HIV/AIDS, which I lead globally, was heavily dependent on American financing for the low-income countries, mostly in Africa, and also lower middle-income countries. The burden of this disease is concentrated here in Africa. 75% of people living with HIV are here in Africa. Now, I know you may want to know why that is, but that's a different question. So, our funding for our work, that's UNAIDS work, was also very dependent on US funding, almost 60% of our funding. The other 40% was coming from Europeans and Japan and a few others, China.
Mm-hmm.
So our own funding, which is to support countries to fight, was reduced. But more importantly, the funding that goes directly to countries, that's the bigger money that helps countries to fight. Like Uganda was getting more than maybe about $450 million every year to fight and prevent HIV. Mm-hmm. That money was also reduced significantly. So it is what it is. Our job changed very quickly from doing so many other things that are technical, that were helping countries, to working with them closely to find ways to fill their gap. That's what we are concentrating on. We had to reduce our size in order to fit in a smaller envelope. So right now we are in a restructuring process and seeing off so many good, dedicated staff members.
That must hurt.
It's very painful. It's very, very painful. It's stressful. You could say it's the hardest piece of job I've done in my entire career. Seeing people who built their lives fighting this disease. Some of them are people living with HIV who came to this fight for their lives and now serve globally. Having to see them go, it's very sad. So, but we are focused very much on supporting countries like Uganda and others that were heavily dependent to move on towards self-financing and to move very quickly. And that means, and without losing what they had gained from a lot of foreign assistance. That's a tough job. So that's where we are focused.
Yeah. I mean, it reminds me of, I think there was also PEPFAR that years ago that, reduced their funding. I think then Uganda had to quickly rush to look internally where to find money to actually, keep the HIV fight alone. I remember the $1 project started. I remember the realigning of HIV or mainstreaming HIV in government work, whether it's works or what. We had to look at, basically raising resources to meet that gap. There was a crisis at that time to sort of do internal revenue mobilization to keep the HIV work going. And I think that's what they're, doing right now to start looking, where do we get money?
Yeah, we are talking more and more and working towards integration. Because you see, with foreign assistance comes also some challenges. The PEPFAR program, which you mentioned, which was a bilateral program by the United States government, a program supported by both parties, the Democrats and the Republicans, started by President Bush, was a very generous contribution. But it was managed directly by the American government. So they built parallel structures for delivering on HIV because their money was purely for HIV. So while our own health systems were falling apart, dilapidated, lacking investment, the money for fighting HIV continued to flow through a parallel system. So they were paying workers, all kinds of health workers, from doctors to nurses, to counselors, to lab technicians, to data entries, all of that they were paying. Now, when they put the money away, this structure that is well paid, that has all the stuff that are needed, can't be afforded by a poor country. Let me give you some data to tell you how difficult it was. A country like Zambia was 91% dependent on foreign assistance for its HIV response.
Oh my God.
By the way, Uganda was 95%. I'm talking about data of about 2 years ago. So with that 95% coming from outside, right? It had a whole parallel system that had brought down deaths by more than a half in 10 years, had reduced new infections by more than 40%.
Wow.
Zambia was on its way to ending AIDS, but with foreign money. When you looked at the total budget for health for that country, 75% of the total budget was fighting one disease, HIV, coming from the American government and some Europeans. Only 25% was going to the rest of the health needs. So now that's the picture for most of our countries, that HIV was very well funded. The rest of health, the governments were putting almost nothing. We're putting too little. So now, without this money, how do you take these great services and pay for them within this tiny budget of health?
Mm-hmm.
That's what we are calling integration. How do you integrate the health, the HIV response into a health system that's broken and weak and fragmented and all of that?
Mm-hmm. Yeah.
So we're trying to work with government to see how to maintain the gains, because this is about lives of people.
Yeah.
If they've been used to having their tablets delivered to them, or they go somewhere and they get their tablets for 3 months, they get checked, their blood is screened they have all this. How do we maintain it with a smaller budget? So we are discussing and supporting governments to achieve, find ways to increase their health budgets, and then also tap into the structure of HIV to serve more diseases.
Yeah.
So what if the nurse was purely for HIV? How can that nurse now also work on TB and this and this and that?
I think what you're talking about, Mama Winnie, is recalibrating our health systems. The shocks in global funding have placed us in a position where we have to rethink our health systems in Africa and maximally utilize our resources.
And increase our investment in health. Let me tell you what shocks me about a country like Uganda. When did you last hear the president speaking about health care in this country? When did you last see him visit a hospital? I can't remember. That leads me to the question, how much of a priority is it on his agenda? Then you look at the data and see, let's compare. Health spending is here in Uganda almost 5% of our national budget. 5. In Rwanda, it is almost 8%. That's a poorer country than us, but putting more into health than us, 8%. Kenya, it's 9%, almost double what we put in. These are our neighbors. We put in less of our budget. When you look even more deeply and you say, and remember there was an African Union commitment to reach 15%.
Yeah.
We are still at 5 in Uganda. We are nowhere near what we agreed with other Africans to put in health. So where is the money going? I looked at what Parliament gets. These noisy members of Parliament who spend more time talking about themselves than about people. They get, I had some figures.
Yeah, but a significant budget goes to the Parliamentary Commission,
Yes.
really.
Yes. If you look, the recurrent budget for health, that includes the wages of all the health workers in the country, doctors, nurses, health aides and all that, is 205 billion this year. 205 billion. That's wages and other costs,
Yeah.
recurrent budget. For Parliament, 834 billion. Yes, 834 billion. 4 times more. Think about that. These loud-mouthed MPs and their travel and their allowances and blah, blah, blah is more than the recurrent budget of health. That's where our priorities are. I looked at public administration figures and I saw how much each country is putting in public administration. That means all these government bureaucrats and their privileges. With Kenya, it's about 11% of their budget. In Rwanda, it's about 25% of their budget paid to the public service. Public administration. I looked for the Uganda figure. It's not there. We are too ashamed to put it out there because it is too high. When you see the money that is spent on these civil servants, presidential advisors, what have you? It is so huge, it's embarrassing. You look through World Bank data, you can't find it. They are ashamed to put it there. It's very high.
Wow.
So health is not a serious priority here. This last weekend, I went with many, many friends. We have an association called Archdiocese of Mbarara Development Association, AMDA. This is an association of Catholic people who live here in Kampala and surrounding cities. We built this community. I was one of a few people who founded this organization 40 years ago. Every year, we go to visit one of our parishes and we take there the services that we can provide as people from here. We mobilize, and the biggest service we deliver is a medical camp, free treatment from eyes to ears, ear, nose and throat, heart, cancer screening, pediatric, everything. We mobilize. Many hospitals give us equipment and stuff, even Mulago give us, even police. We collect a lot. But do you know, there at Nyamtanga where we were visiting, the lines of people who came for free treatment were so long, several kilometers long. We treated on one single day about 6,000 people who came from villages far just to get a test or to check their ears or to heart problem, cancer screening, because they go to hospitals, they give them a cheat. From then on, they must pay. If they have to get a test, they pay. If they have to go for radio, for an X-ray, they pay. They don't have the money. This is the truth, that the healthcare isn't there for the majority of people.
And we need to recalibrate to make it, to take our healthcare very, very seriously.
and invest more in it.
And invest more in it.
And cut some of this waste and all this money that the
Public expenditure.
parasitic people take. Every time the parliament sits, they increase their salaries and benefits.
Wow.
And they shop.
Yeah.
They travel and I saw the speaker wears the same dresses that the princesses of the UK wear. Imagine. I mean, how carried away can you get?
Yeah.
You are from Bukedea and you are wearing a dress like a princess in the UK. I mean, that's one of the 7 richest countries in the world. That's one of the richest families in the world. Who are you? You see, people are carried away.
Yeah.
With their greed, their benefits.
I hear you passionately about that. The other thing which I know you're very passionate about is sexual reproductive health and rights. And I recently heard you on the Baraza talking about how it is important for us to, put SRHR as part of our health system in Uganda. Would love to hear your views on that.
Well, again, I won't say that we haven't been making progress. We have, but we have serious challenges on sexual, reproductive health and rights. I think about 10 years ago, about 16 women were dying every day during childbirth. That's a number that's, even 1 is too high. But 16 from morning till evening would be dying because of bleeding, because of lack of a birth attendant at birth, for many reasons. Many times because they were teenagers. So today that number is about 8. So we've reduced it by a half. Which is
a great
good thing.
milestone, yeah.
Yeah, there was some more investment in maternal
health. Yeah.
And it must continue.
Yeah.
But we still have huge challenges that almost a half of all women do not have access to what they need for their sexual health, right?
Yeah.
So we need to do more in terms of the investment and the quality of the investment in women's health. That's one. I mean, for example, almost, I don't know, I don't have the data in my head, but cervical cancer. Cervical cancer is very common amongst women living with HIV. That cervical cancer is preventable. There's an injection that you can give a 12-year-old before they get into before they reach full puberty, and they will not get it. So many countries are already providing this injection to schoolgirls at that age. They're targeting them at school and giving them that vaccine. Here, not much progress on it. In Rwanda, I heard that they have already covered all the girls. Yes, right? Then screening. If a woman can be screened for cervical cancer and it's caught early, it is treatable. But most of the time, a woman finds out when she's stage 4 cancer because there's no screening. Almost all our hospitals don't have a machine for screening. Screening has become so simple. People go with a van, just drive with a van in villages, screening women. So the investment in our health is so low. We are spending money on wars in Congo, in Sudan, in what? It's painful to think about because what's needed for people's health isn't very high technology, but it needs to be there at the nearest point of service delivery. So much still needs to be done on women's health in terms of the investment and the quality of the investment, but also much needs to be done on rights of women and girls, because you can have the service there, but the woman may not go there because they are denied rights. because they don't control their own bodies.
Yeah.
A woman may die in her 8th birth, giving birth to the 8th child, not because she wants to have them, but because she has no say about how many kids she can have, when she can have them. Girls, 20% of the deaths, maternal deaths, are of teenage girls. They die trying, many of them die trying to commit abortion, to remove an unwanted pregnancy. And do you know who is responsible for the pregnancy? We have data. Most of them have slept with a relative in their own home. It's incest. It's an uncle. It's a cousin. It's not a boyfriend even. It is authority figures. It is a school teacher. They are not allowed to have an abortion. Why? It's all this religiosity that's killing our children. In the name of God, our girls are dying. What is that? We should be able to allow abortion in certain circumstances, including that.
Incest, rape.
Rape, yes, but you see, most girls will not come forward and say, I've been raped by my uncle. They will just be pregnant. They're not going to say who. So how do you deal with that? They won't say it's my teacher. So how do you deal with that? But they will go to have a backstreet abortion and die. So you need to look at the data and find a solution. And the solution does not have to comply with the edicts of religious men.
You know, that brings me to this conversation, Winnie. So many of the girls that go through this go and do backstreet abortion, including, I've visited different centers where they're providing post-abortion care and listened to heart-wrenching stories of how the girls, commit these crude abortions. Some of them take detergent with, a high concentration of tea leaves. Others use even sharp objects. They're naive. And they have perforated uteruses. Some of them, their uteruses have been removed. Some of them just go to unqualified, medical people. And it's really, some of them never make it. Think about it. We provide post-abortion care budgets in many of our hospitals. And yet we, are against abortion.
Prevented that.
But the question is, even with all these different reports that have been released by national, global, bodies, when these figures are presented to the people who shape our legal and policy frameworks as a country, it becomes a question of reality versus morality. Well, I'm a Catholic, my electorate, how will they see me? And yet the data presents something different.
This issue is very, very close to my heart. This issue of injustice to women and girls over their own bodies. The first dead body I saw in my life, I must have been about 13 years old, was of my cousin, Banyima. My cousin had not had an education. My uncles were peasants who didn't go to school. Their daughters would go to herd cattle just like the boys. She must have had sex while she was out there grazing cows, probably with a worker. Somebody was grazing my father's cows. All our cows were together. I don't know who she had sex with, but she was working out there with adults when she was a little girl. She was about my age, actually 1 year younger. She may have been 12. I saw her dead body in Barra Hospital because she was rushed there. She had tried to commit an abortion to live up to the expectations of her parents, and it had gone bad. She had gone septic and she died. It hit me hard. I was a little girl. Just to know that if Banyima had been in a classroom like me, that would never have happened. But Banyima at 12 was doing adult work, grazing cows alongside men who were also grazing for a salary, and she got pregnant. So this is the injustice to girls. This is the injustice to girls, that they find themselves in contexts where they cannot control their bodies, they cannot say no often to people they trust. And then the society refuses to give them a solution. If they give birth to that child, they are rejected by their parents. They have no means to look after that child. If they are in school and it's a teacher, that's the end of their education. These days, reluctantly, Uganda has also agreed to have a radical inclusion policy of keeping girls in school after giving birth. That's a positive thing.
I
but
think
it's
they work
not
with
enough.
UNICEF.
There are very many whose lives are lost. So much still needs to be done to achieve justice for women and girls regarding their bodies, the control of their own bodies, the decisions over their own bodies, and to change mindsets of people out there. I'm a Catholic woman, and I know what my religion says, but there are areas where I don't agree.
Yeah, I mean, let's face it here, because look at sexuality education in our schools. I mean, we don't have a schools health policy that speaks to that, about, teaching. Many of these girls have sex. They are maybe trying it out. They don't even know what to do. I mean, they're just trying it, because many of them do not even know, that maybe there's access to, think about access to contraceptives, access to condoms. There's access to this information that maybe they make informed decisions. Even when you look at preventive approaches, even with that, our laws and policies are a bit strict to some of these things.
I think a bit is an understatement. Sexuality education is the difference between life and death for girls especially. Not having that knowledge about their bodies, about how to protect themselves, about their health, can be a death sentence. So all these people who, in the name of religion and tradition and culture, are denying our schoolgirls sexuality education, are passing a death sentence to some of them. That's what it amounts to. And what I really find so contemptible is the hypocrisy around it. You see, the women and the men who make the policies, the powerful people in parliament, the ministers, if their daughter were to get pregnant, they would rush them to a clinic, pay money for a safe abortion. But they will come in the parliament and stand there and say, we are a Christian nation. We are not allowing this. It's hypocrisy at the highest level, right? So we need a movement of the ordinary people. I've found that the most radical feminists are women living in poverty. If you ask an ordinary woman out there in the village that if your daughter is made pregnant by your brother-in-law, what should be done? She would tell you that get that pregnancy out. It's an unwanted child. It will always remind that girl of the crime by the uncle. It will always be a shame in the family. She will become like cursed. That child will never be fit in the family. She will say, get it out. A poor woman will say that. But a hypocritical woman in the parliament of Uganda or minister in the cabinet will say, no, we are Christians, we cannot tolerate that. So for me, it is the justice that people demand that is what should shape the law. poor people living in our villages and in our slums in the cities, those people's justice is what I respect, not the justice of hypocritical middle-class people who practice one thing and say another.
Yeah. I mean, we've talked about the legal framework. In many of our countries, including Uganda, abortion is illegal and it's punishable by incarceration. I mean, it's not only here in Uganda. Senegal has so many women. In fact, I read a report from the special rapporteur to the UN that was speaking that many of the women in Senegal's prisons are there because of abortion-related cases. There are so many women who have been in prison, medical workers who have supported, for example, post-abortion care. They have been arrested sometimes. So the incarceration of women who have, committed. In fact, in Senegal, sometimes they get them at the point of coming to receive post-abortion care. So, I mean, the medical workers then call the police. Throughout Africa, abortion, because of the penal code that was framed by the colonialists, they made it criminal for abortion and it's punishable by imprisonment. What do you make of the incarceration of women who have committed abortion because perhaps they're not ready to carry the pregnancy or they've been raped or they have had an incest? Do you think that there's need to review the penal code or the legal and policy framework around?
Absolutely. In many countries like ours now, we see legal reform in that direction, where abortion is permitted under certain conditions. And the more you vary the conditions, the more you open for different contexts so that there is justice for everyone. In many countries, abortion remains illegal. But like I've said, they open for various conditions. You can have an abortion if you are raped, you can have an abortion if it's a case of incest, you can have an abortion, and so on and so on and so on. Threatens the life of the mother. All these openings are progressive steps towards giving girls and women justice. We need to move in that direction. These blunt declarations that are based on religions that are governed by men anyway, are just not right. They are costing us our lives of our people and adding to the burden of care in the hospitals. So yeah, there's much to do.
There are medical workers actually who are serving sentences for maybe, supporting women.
That as well. If I can tell you of, the regulation of our bodies remains one of the frontier battles in the struggle for equality of men and women. We continue to have laws across the world that are so unjust, that are about controlling the bodies of women by men, by those in power. I was in prison some years ago. I had not stolen. I just had political differences with President Museveni. I found myself at Ginger Road Police Station. I was in a cell with 4 other women, and we shared our stories. One story I never forgot. I remember all their stories, but one I want to tell you now was a young woman. She looked like she was 16. Her name was Sophie. Sophie didn't speak any language I understood, but through a lot of communication, I realized that she was a Teso. She had been brought to the city by a woman who was her mother's friend to be a house girl in the city. She was not in school, there was no money, so her mother gave her to her friend, a madam in the city, to go be house girl. She started her job somewhere in this city, Kampala, and after some time, the man of the house imposed himself on her, had sex with her. I don't know how many times, but soon enough, Madame found out that the man of the house was sneaking back home from work to sleep with the house girl. She beat her up badly and threw her out, and she went on the street. A girl who speaks only Itesot and who doesn't know anyone in Kampala. She ends up on the street with other girls and becomes a sex worker. Now, then in one swoop in the city, the police make money from sex workers. They arrest them and they extort money from them because prostitution is illegal. So they are a source of income for policemen. They grab them, they take their money, and then they release them. She had no money. She ends up in jail. So here was Sophie, a girl who the government failed her by not putting her in school for free. Her mother sent her to work. She's abused by the man of the house. She's abused by the wife, the madam. She goes on the street. She finds some way to earn money and safety with other girls. And the state now punishes her with prison. There was nobody who was going to bail her out. Nobody cared about her. These are the injustices that women face and girls face. Being poor, a state that doesn't deliver the right to education and health, and a state that is ready to imprison her for making income from what is not a good job, not really a job, but a method of coping with poverty and homelessness. So I give you this story to tell you that women's lives are hard, and they are made hard not only by culture and religion that sets rules about their bodies, harsh rules, but also by a government that pretends not to have the data and to understand what poverty exclusion does to women and uses the same rules to oppress women.
Yeah. How important is it for Africa to start decolonizing or revisiting those laws that were set up by our colonizers to reflect what really is today?
We must first radically end this inferiority complex that we have towards the rich industrialized countries, our former colonizers, and make the rules that work for ourselves. So these are struggles at the policy level to look at the rules that we borrowed and seeing what is working for us. Is this really working? But it's also very personal that we also examine ourselves and see where do we put value? What do we value? What do we not value? Is this really, are these the choices we should make given who we are and our country and our resources and our people and their history? So yeah, there is a need to decolonize, and I'm seeing it now where I am at the UN. Last night I was in a meeting with my colleagues, other heads of agencies, and we were talking about the reforms we are doing, which have been triggered by the aid cuts, right? But we have said we will not respond just by responding to reducing costs. We are going to reimagine and recreate the United Nations so that it serves its people better. Yes, the trigger is less money, but the response must be strategic and about reimagination and recreation. So I used this word in that meeting. I said, for me, UN80, which is the process of reform, is an opportunity for decolonization. Because what we have to do now is change our relationship with the governments, respect their leadership and their right to self-determination, and support in ways that help them to close some gaps and stand on their feet, but do not continue relationships of dependence.
Yeah.
So, yeah, decolonization is the thing. From where I sit, I have an agenda to decolonize the UN. From where you sit, decolonize the media.
Yeah.
Next time you come here, wear a white shirt.
Oh, an African print.
Yes.
Thank you. Winnie.
Yeah.
Thank you very much for, well, I even feel shy calling you Winnie. You told
I
me to call
am
you
Winnie. Just say Winnie.
Winnie Banyima, thank you very much for sharing your heart out.
Thank you,
very much
Solomon.
for having us. Thank you for your time. Thank you very much for being part of the show.
Thank you. I love the conversations with you.